One of the most common questions I hear before surgery is how long will I be in the hospital? The answer depends on the type of surgery you're having, how you're recovering afterward, and what's safest for you. You may also hear terms like outpatient, 23-hour observation, or inpatient surgery. These are administrative and billing designations that help the hospital organize your care. They do not determine when you go home. Your discharge is always based on your recovery, what's safest for you, never a clock. Let me briefly explain each of these recovery pathways. If you're having an outpatient procedure, in urology, these are scrotal, inguinal, or endoscopic surgeries, you'll recover for a few hours after the operation. Once you're awake, your pain is well controlled, you're able to walk safely, and you're meeting all of your discharge goals, you'll go home later that same day with a responsible adult. For many of our robotic surgery patients, we're now using what's called a 23-hour recovery pathway. This has become an important part of helping patients recover more comfortably while also getting them home sooner whenever possible. The 23-hour designation refers to the fact that we expect you to stay in the hospital no longer than one night. After surgery, you'll recover in our post-anesthesia care unit, or PACU, where specially trained nurses will monitor you closely as you wake up from anesthesia and continue your recovery. If your surgery is completed early in the day and you're recovering exceptionally well, you may even be able to go home later that same day. If you need a little bit more time, you'll simply stay overnight in the PACU or occasionally be moved to a room, where you'll continue to receive expert nursing care. Your surgical team, including our amazing physician assistants and residents, will see you after surgery and again the following morning to review your recovery and prepare you for discharge. Our goal is that for all patients staying overnight to be ready to go home before late morning whenever possible. One concern we sometimes hear is that 23 hours means you'll have to leave exactly 23 hours after surgery. That's not the case. The name simply refers to an administrative designation, not a countdown timer. Some patients go home sooner, while others may need additional care. If we believe it's safest for you to stay longer, we'll simply admit you to the hospital. Our recommendations are always based on your medical needs and your recovery. And finally, some patients are expected to have an inpatient stay from the beginning. This is usually because the operation is more complex, additional monitoring is needed, or other medical conditions make a longer stay the safest choice. In those cases, you'll recover in a hospital room until you're ready to go home. Before your surgery, we'll discuss which recovery pathways we expect for you, and occasionally that plan changes based on how your surgery goes or how you're recovering afterward, and that is completely normal. No matter which pathway is right for you, our goal is always the same: to provide outstanding care, help you recover safely and comfortably, and get you home as soon as it's medically appropriate. Thank you for trusting us with your care. We look forward to taking great care of you.